So let's start this conversation with a more broad discussion about the function of muscle. We know that there's some mechanical functions, helps with our posture, our movement, stabilizing our joints. But will you get us started today by talking about some of the other physiological functions that really make muscle so important?
Yeah, thank you. The role of muscle, the obvious role, we have structure and mass. It's part of daily activity. People don't really think about it as functional for bone health. Actually, our bone health is very much related to it. So more structural aspects. Our ability to survive things like a hip fracture or cancer therapy directly relates to bone mass. But I think probably the thing people don't understand is it's also our only voluntary link to metabolism. And so our metabolic regulation, from glucose metabolism to fatty acid metabolism, also really is focused on muscle. If we're having problems with either glucose metabolism or fat metabolism, it probably means we have a muscle problem.
Indeed. And I'm picturing, maybe others who are listening are picturing the functional medicine matrix in their mind and looking at how muscle can impact so many different body systems. And I think we understand from a physical fitness perspective, muscle is obviously really beneficial. But will you talk to us about how there might be some interplay with our cardiovascular system?
Yeah. I mean, obviously, muscle from a mobility standpoint directly relates to your heart function, your vascular system. So, how big is the plumbing? Is it healthy and your heart strong? And all that relates to physical activity and exercise. But, as I started out, the aspect, I like to tell people, if you encounter somebody who has a problem with blood sugar, if you encounter someone who has insulin resistance, that's a muscle problem. If you encounter somebody with abnormal blood lipids, high free fatty acids or triglycerides, that's a muscle problem. People don't recognize that muscle has a very important role in selecting our fuels. And what those things mean is that our carbohydrate and fat choices are out of balance.
Hmm. Well, I'm keeping notes so I can make sure to return to that later. But before I do, I have to ask you about mitochondrial function because mitochondria are my personal
Yeah.
favorite thing to talk about. And I know that there's this relationship between mitochondrial biogenesis and exercise, and there's so much impact in our muscle. Will you talk to us a little bit about those connecting points between our muscle tissue and our mitochondria?
Yeah. So, again, most people recognize me as a protein expert, but I like to think of really our muscle centric health is kind of the key to it. Um, Exercise, particularly more aerobic types of exercise, have a big impact on the number of mitochondria in your muscle. And if your muscle's really healthy and you have healthy, reasonable numbers of mitochondria, the primary fuel in skeletal muscle is fat. So the fuel distribution in skeletal muscle under normal healthy conditions should be about 80-20 fatty acids to carbohydrates. But when you stop and think about our American diet, we're eating about 55-35 carbohydrate to fat. We're eating the opposite direction. And that causes some very serious metabolic stress to skeletal muscle.
Well, that's a perfect lead into what I was planning to ask you about next, which is I mean, you mentioned how important muscle is in our resiliency. And I'm imagining there's various ways that we're losing muscle or our muscle health begins to decline because of we're aging, we're more inactive, maybe we have some disease process going on. I mean, what is the biggest contributor to a loss of healthy muscle that you're seeing in just the common person?
Well, there's two issues. One is just getting older.
Yeah.
I think one of the things people need to keep in mind is that if you just keep doing what you're doing, as Albert Einstein said, you'll continue to get what you got. But I think it's important to recognize that for each decade, you lose about 4% lean mass. So if you continue doing whatever you were doing at 30, at 70, you're going to have a significant loss of lean mass. The other thing to keep in mind on that regard is that we lose about 100 calories of energy expenditure, resting energy expenditure per decade. So again, 30 to 70s, you're going to lose about 400 calories per day in energy expenditure. So now what we need is higher protein, higher nutrient density, and fewer calories. The other aspect, and my good friend and colleague who passed away, Doug Patton Jones, indicated that aging is not really a linear process. It's actually, and he coined the term, a series of catabolic crises. That as we go through life, we will encounter things. It might be COVID and bed rest. It might be breaking a bone and you're incapacitated, or some other form. It might be a cancer and treatment. It might, we encounter things. And during each of these, there are significant losses of muscle mass. If you're 25, your loss over a 2-week period might be 3-4 pounds of muscle mass, and you can gain that back quickly. But if you're 65, you might lose 14 pounds of muscle mass in 2 weeks, and your ability to gain it back is extremely low, and without serious resistance exercise, probably negligible. So basically, we have normal aging loss, and then we have what we refer to as catabolic crises and sort of acute losses that get more and more important as we get older.
Right. Well, it seems like maybe we get stuck in these patterns of eating the same foods we've always eaten and doing the same activities we've always done. But actually, as we're aging, those needs change. I mean, is that something you're finding? People just are not aware that they need to adjust their nutrition and their activity as they get older.
Yeah. I mean, again, a lot of our dietary guidelines are based on 25-year-olds who tend to be closer to ideal weight. They tend to be more physically active. They can eat more calories. And so we hear about, the amount of protein people are eating and the amount of calories, and it's usually based more on young people. And as I've just said that, as we get older, our resting energy expenditure goes down, we lose the amount of calories, and yet we still have the same nutrient needs. And in fact, in muscle, we have what we call anabolic resistance, and we actually need more essential amino acids as we get older. Just to give you a frame of reference for that, a 25-year-old will have a fairly robust stimulation of muscle protein synthesis with 15 grams of protein, where to get the same effect in a 65-year-old will require over 30 grams of protein. So, you have fewer calories and yet you need more protein.
Hmm. You've highlighted so many connecting points between the immune system, our cardiovascular system, our metabolic health. So when we see this loss of lean muscle, is that showing us some red flags or raising your index of suspicion that we need to look at other areas of the body? Maybe we need to be more aggressive in our glucose screening or really look at insulin resistance. How does that impact the way that we do precision and preventive medicine?
Yeah. I think, as we get more precise, as we get more personalized, I think one of the things the research is totally clear on is that if you encounter someone with what we call metabolic syndrome or pre-diabetes that exhibits elevated fasting blood glucose, elevated triglycerides, lower HDL, all of those, the abdominal obesity, all of those signs, those are carbohydrate problems. That means your carbohydrate to protein ratio is probably out of balance for your muscle health. And we've done studies and a lot of others, in the last 20 years. There's a lot of studies that show that if you reduce your carbohydrate level down, the average American's eating 300 to 300 plus grams of carbohydrate per day. The RDA for carbohydrate, most people don't even recognize there is one, is 130 grams per day. So we're eating 3 times our carbohydrate minimum needs. And so if we reduce it, the carbohydrate down below 140 grams per day, the research is pretty clear that you'll correct all of those metabolic syndrome characteristics within weeks, within 10 to 14 days, actually.
Wow. And is that true even for someone who might be 60 or 65?
Yeah, we've personally done a lot of work with individuals in their 50s. Haven't
Mm-hmm.
done as much with people in their 70s, but there is some data about out that there about that. I think it's true, but there's a lot less data on that specific topic, you know, into diabetes with older age groups.
Sure. But it certainly makes sense to me when I think
Yeah,
about it.
I see no reason why it wouldn't be true, and again, there's some data, but not nearly as much.